Hi, everyone. This is Janice and the Board of Directors of the Filipino American Chamber of Commerce. We have Kat Iniba, we have Fred Dr. Zell, and of course, we have Dr. Maricel Aluning. And today, we are so proud and happy to present to you our featured business, which is Carson's best and favorite dentist, Dr. Maricel Aluning. Let's see a little bit of a PSA about her before put her on the spotlight. Go ahead, Kat.
Welcome to Carson Dental Care.
Hi, I'm Dr. Maria Aluning, a general dentist. I have 6 team members and we have over 1,000 active clients.
Here at Carson Dental Care, we make sure that our clients are comfortable.
Everybody, you need to come to her. I'm terrified of needles and I felt nothing. It's amazing. I love you.
There you go. As one of her satisfied patients, I am so happy and honored to present to you Dr. Maricel Aluning of Carson Dental Care. Hi, Doc.
Hello, everyone. Hello, Janice, Kat, and Fred. I am blessed and thankful for this opportunity and also being part of and the treasurer of the Filipino American Chamber of Commerce of Los Angeles area. And I am honored to be one of the presenters today. I'm kind of nervous. It's a last-minute thing, but I'm here. I will definitely answer all your questions, whatever you may have. If we have any guests or somebody that is watching that you have a particular question regarding dentistry, please type it in, and I will try my best to answer your questions. If I'm put on the spot and I don't know the answer of your question, I will definitely get back to you and answer that. So thank you again.
I don't think you're nervous at all. This is your favorite. I mean, this is your sweet spot. This is who you are and what you do. So I don't think you have any reason to be nervous. And you know what? I'm going to put you on the spotlight right now and tell everybody who you are and why you became a dentist. How about that?
Okay, so again, the full name is Maria Cecilia Aluning. I am from Philippines. I have been a dentist for 20 years, and how I started, I came to the United States in 1980. I was almost 15 years old. We were in Las Vegas. I started working at that age. I was actually, I don't know if anybody knows, or I think it's in online somewhere that I have been a bus person. I work in a casino. I have been a waitress. And then going to school at the same time and community college, I wanted to be, at first I wanted to be computer science, but it wasn't for me, I think. And then second, to be a nurse, but I said, I don't think it's for me. So I have decided to go back to the Philippines in 1986 to study dentistry. I graduated in 1992. Right after graduation, I came back to the US and took the boards. Passed the license in 1998, and I have been a dentist since then. It's almost 20 years, or going on 22. I've been in my practice for 20 years, almost this September. My uncle, Dr. Billy Torres, started the practice. He was here in the 70s, and when he retired in 2000, he sold me the practice, and no regrets. I'm happy to be here. I'm happy to be part of Carson community, to be of service to them for all these years. There we go.
Wow, you see, that was easy, right? Well, hey, Fred and Kat, let's put her on the spot and ask away.
Yes, I think Dr. Maricel isn't used to being on the spot. She's used to putting the light on her patients. But,
Exactly.
but you did great. You mentioned that you've been in the field for the last 20 years. Obviously, that's a long time. For those of you that did the math, she started when she was 12 years old. but but you know, a lot of dentists they kind of have to work their way up. And you mentioned that it was your uncle's practice that you took over. Would you say that was that was a plus for you, or was there like additional challenges involved with that, or how did you feel about taking over somebody's built up practice already and kind of living up to those expectations that he set?
Actually, yes, it was a plus definitely because the practice has been here for over 25 years. So he already had a stream of patients. But he before he retired, when I was assisting him in '92 after graduation, I was assisting. We were doing mobile dentistry. So what we do is we go to nursing homes. We had about 50 nursing homes that we go to on a daily basis. Well, for the month, and I thought to myself when I said that when I become a dentist, I don't think I want to do this. But because it was so tiring, but when he offered me the practice when he retired in 2000, I said I'm gonna go for it, and it was a blessing. Sorry, my husband's been calling me. So he's probably not watching. That's why he's calling me.
Mhm, obviously.
It was definitely A plus, and I did the mobile dentistry for about 12 years, and decided in 2013 that I would just wanted to concentrate and in the office to build it, and then offers all types of dentistry to the people, my patients.
And it turned out to be a very good decision, didn't it?
It sure did, yes.
Hey, Kat, I know you have some questions for her. Have to unmute.
Sorry, I just realized I was on mute. I do actually, now that we're slowly opening businesses because of the COVID pandemic. Can you tell us? I know a couple of my friends were asking some of the steps you're taking due to the pandemic, like the how we can be comfortable in coming to visit.
Oh, yes, thanks for asking that because for sure a lot of people are scared of coming to the dentist right away, right now at this moment. Before the pandemic, we have always been doing a universal precautions. So we put our masks, our gloves, our uh, I'm so sorry. And now during pandemic we had to buy extra equipments like just recently my extra oral suctions came in, so that is an extra. And also we have some questionnaires we ask our patients, just like any business that you come in when during this pandemic that there is a certain questions that you have to answer first. Our doors are locked before the patients come in to make sure to screen them, to make sure that they are, they're not positive and they are free from, they have not gone to any places that are COVID, a lot of COVID positives. And I have also equipped my front office with the shield. Each patient also, we do the operatories so that all those aerosols and the bacteria around on the dental operatories will be killed. And I have equipped my practice with air doctors. So there's one in the lobby and also in the hallway of the office. So definitely it is safe going to the office nowadays. And there's has been a lot of emergencies that's been coming in because of COVID. They have not been going to the dentist, and we are almost into our pre-COVID appointments right now. But another thing, what we have to do is we have to separate our schedules. We cannot pack our office like before. Like people are waiting, patients are waiting in the front in the lobby, and we have to have them one at a time, really. So that's what we have been doing, and yes, it's safe coming to the dentist.
Yeah.
And actually, if I may add to that, we are actually prone to catching all those bacteria that from other people because we are so close to the patients. So us dentists and even the hygienists are scared of coming back to the offices because of that problem.
Mhm.
And we have been working without hygienists, so we have to do. I have to do all those things, and I just have to protect myself with the face shields,
Yeah.
my loop, and also a 95 face mask. And it makes it more harder for us because at the end of the day, it makes me so tired because of not enough oxygen coming into the system. So yeah.
Yeah.
I noticed that you always been really actively seeking classes, new courses, and updating yourself with the technology with dentistry. So besides the usual extractions and implants, or what a general dentistry office would usually offer, what other special services does your office have?
Oh, okay, great question. For me, it's a nonstop schooling and studying because I have the growth mindset that I always have to learn about something because I don't want to be left behind. So in my practice, I would call probably my practice a one-stop shop dental office because I would do the general dentistry with general. What the scope of that would be the regular cleanings, deep cleanings, crown and bridges, also extractions, and I have also added implants, braces, the traditional, and also Invisalign. And also, I have also been to equip myself to study about sleep apnea because I know a lot of people are suffering with not having enough a good night's rest because of sleep apnea. So I'm able to test my patients with and send them the sleep equipment to check instead of going to a doctor's office and sleep there for the night. So they get to take home the sleep test, and then the result will come back to me the next day, and I will send it to a medical doctor. So yeah, it's well around dental scope of medicine.
And I know that you're up to date with the most technologically advanced equipment, right?
For sure, yeah. I just invested quite a sum of money on the CBCT, which is a cone beam or 3D that takes an X-ray of your from here to up there. So that actually is an A plus, an added value to my patients because I'm able to diagnose much better. I'm able to diagnose what I cannot find on the traditional X-ray. Just for example, before COVID, I had a patient that came in and he was in pain, and I looked at the traditional X-ray and I said, okay, we can still save this tooth. It's gonna need a root canal, but then I referred him to a specialist because it was quite of a difficult case for my office to do the root canal. So COVID hit. So after COVID, he came back. He was in pain again, and he wasn't able to have the procedure done. But because I had the equipment, the CBCT, I was able to get a scan and then found out that if he had gone to a specialist for root canal, it would have failed because there was already infection that I wasn't able to see really well. And by taking the scan, it gave me the better diagnosis for the patient. And I'm just glad that I did that. I don't charge extra for the patient unless they ask a copy of their CT scan. So I think investment of something like that is just have given me the confidence of that I'm doing a better job, that I'm giving them a better diagnosis and what is the best treatment for them. So yeah, and also we have an iTero scanner. And used to be when we take chronic breaths, we have to do the impression when put it in patient's mouth. It is still gooey. Nowadays, we just scan the teeth and also send it to the lab and comes back to us a lot faster. So those are the technologies that I have in my practice besides having the digital x-ray and also intraoral camera. And it just made my practice a lot, the streamline, smoother going along. And I'm proud to say that I'm coping up with the trend. So I'm not getting behind. So yeah.
Hey, we have a question from our audience. From our friend Dawn here, she says dental work can be expensive for patients, especially without insurance coverage. What programs are available for low income or underinsured patients to assist with our out of pocket expenses? I think that goes along with the question that Fred was going to ask next.
Wow. Okay. Good question. So in my practice, I'm one of the dentists around the South Bay area or Carson area that takes medical. So regardless of what insurance you may have, you are treated the same way as I treat my family. So I'm really proud of that. Uh, we also have for those that doesn't have insurance, we also offer a discount plan, wherein they can pay on a monthly basis, just like having an insurance, and it's a membership plan, and then you get this 20% discount of the services that we offer. For the major work, perhaps 10% and 20% for the basic services. Um, and also, we have payment options. Through Care Credit, we can do an in-office financing if you may have to, but I am easy to talk to. If any way that I can help my patients, I will be glad to help them. So yeah.
I know that for sure because I've sent emergency patients to you who have been suffering, and even off office hours or the weekend, you're one of those dentists that will truly come to their rescue and take them out of their misery, even no matter how they hate going to the dentist.
Exactly. So yeah, I even give them my personal cell phone because I do care about my patients, especially if it has been, extractions or surgery that I did or anything difficult treatment. I I I made it a point that I do a follow up on them at the end of the day to see how they're doing, if there's any questions that they may have. So I will call them, and patients really appreciate those things. Sometimes I forget because, but the next day I will call them. So if sometimes even if I wasn't able to do it, my staff will do it for me. So yeah,
Awesome. Follow up is golden, right? And
yes, for
Fred
sure.
has a bunch of questions for you too.
Oh wow.
Yeah, actually, your earlier question you already answered because I was going to ask in terms of, the cost involved in insurance, Medicare, Medi-Cal. So that's awesome that that is all covered. But you touched on this briefly, and I made a crack on it when we started earlier. But there are a lot of people out there that are afraid of needles and specifically afraid of dentists. You talked about like the follow up and putting people at ease, but how do you deal with those individuals that are just scared to,
Yes.
to take care of whatever issues they have?
Great question. Actually, for some reason, when they come to the dental office, the blood pressure just raises up. It's so elevated. It's because sometimes they're anxious and they're just scared. So what I do is I really get to know the patient and ask them, especially the new patients. We have several that it's really scared. I find out why. If they had any bad experience, I find out about that, and then I talk to them that it doesn't really have to be painful. And then as once they have your trust, and they tried how I take care of them, how I give them injections, and I'm happy to say that when they come inside scared, they will go out happy and smiling. Just recently, just the other day, I had a patient and she was almost crying. Just I said, it's not done yet, but save that the next time you come back. So I put that up. Yeah. And also when giving injection, I really wait, and I have this device called Dental Vibe, wherein it has its vibration. And if you notice on, I think it shows on the patient that says, you have to come here, I didn't feel anything, and the commercial, that patient particularly, she needed an extraction. I have to tell that story behind that thing that she was saying. She was scheduled for extraction, and then she had, when she came to the front office, she had to go 3 times around the block because she was either, do I go in, do I go or not? And at that time we were having the video taken. I said, this is perfect. And we had her come in, and I gave it a shot. She didn't feel it, and she just loved it. That's that. What she said that it was truly what happened. So yeah, I have that. So when I give that shot, uh, the brain will just concentrate on the vibration so that they don't feel that needle coming in. And I usually would ask them, did you feel anything? They said no. So that's how it starts, just getting them rapport, a good rapport, and then really get trust me. And also when they come in, I really ask them, what can I do for you? It's like, are you? And then I would ask him, are you happy with your smile? They may come in with pain. I will take care of the pain. But then again, if I see something going on that can enhance the way they look, the way they smile, I will talk to them about it. I will do a comprehensive exam. Sometimes I spend too long with them because I wanted to show them and also explain what happened. And regardless of they want to do it in my office or not, that's what they need. So I always tell them that, okay, so this is what you need. If you know, if you're happy with us, you know, regardless if you do it here or not, you know, it's what I see. So yeah, that's I get it. I get my staff sometimes will get in the door because I'm spending too much time in a patient and I already have somebody waiting on me. But yeah, I do spend time and explain. And so most of the time they will say, "How come I never knew about this?" But yeah, so, so that's how I do in my office.
That's awesome. Hey, Kat, you're
Yeah.
laughing, you're smiling. I think you have a lot of questions in your mind too.
I do actually. You were talking about extractions, and then I was thinking about the commercial, and one of your patients was talking about implants and how she came in and then she left with a smile, a beautiful smile. Is that possible, or what? Can you tell us a little bit more about that?
Are you talking about the commercial that we see on TV
Yes,
that
that commercial.
they come in? So it's actually not my patient. So it was I see that there's already pre-planned because coming in with no teeth, with a lot of things going on in her mouth. She's been in so talking about this commercial that you're
Yeah,
talking about.
yeah.
You had a beautiful smile. They showed us if that said that if you can pay car payment and we can pay for this. Uh, Years, probably months back, she has already gone to the office and really pre-planned everything already. And then once the surgery is ready and scheduled, she will that will it's possible that she will come out with a beautiful smile. But it doesn't happen like she just goes in right away,
Overnight.
at the end of the day that she will go out. So it has been planned. It has been CT scan and measured what type of implants that she needs, and also had that dentures made and whatnot. And yeah, but yeah, and in my practice, I don't do the same day because that bone, if you have an implant, that bone needs to heal. We need to wait at least about 3 to 4 months to load the crown, to put the crown in, because that bone has to integrate to the bone. The implant has to integrate to the bone. Otherwise, it's going to fail. So it takes a lot of planning. It takes a lot of it takes time for some patients will wait 4 to 6 months actually from start to finish.
Is that what bone graft is considered, or is because my boyfriend had to go in and they wanted to do like a bone? I don't know if I'm even making sense. They wanted him to do a bone graft so that a bone would grow as a tooth? Does that make any sense?
Okay. So now, before we never really pay attention of putting bone graft on the extraction side. So nowadays, it's really common for somebody for a patient to come in that, okay, the doctor will ask them, okay, we need bone graft on this, because once the tooth is removed, the bone will shrink. So if a patient is planning to have an implant or something placed in there later on, it's good to put a bone graft so that it to preserve the height of the bone. Um, there's several types of bone graft. We pretty much use the allograft, or nowadays it's the growth factors or the PRP, wherein we can draw blood and mix it with the bone to make it a sticky bone, things like that. But bone graft is something that is needed. It's not necessary, but needed. It's because even if without bone graft, the bone will still heal. But after healing, the bone will shrink. So you don't want that. Sometimes you'll see that, you have
Yeah.
the patient here because there's not enough bone anymore.
Mhm.
Um, yeah, so I do it myself in the office.
Me too. Okay.
It's either allograft or the growth factors, or which is PRP. So
Okay.
Is
does
No,
that
that answer the question?
yes? I was listening to you, and I was going to ask about that procedure that uses your own blood or a patient's blood to help with the treatment. Can you explain a little bit more about that?
yeah.
Okay, so those are the what we call the PRP, growth factors, wherein it makes the healing better. I made a little note on my so the bone will regenerate and heals. Get the regeneration is much faster, and the most of my patients will say it's less painful when I do this, and also what we do is it is still mixed with a little bit of bone. We just make it sticky, but draw the blood first and centrifuge it, and then once it's ready, we just put it on the socket. So but it does help with bone regeneration and also uh, bone healing.
Oh, that's nice.
Yeah.
How about a another procedure that is very popular right now? That Invisalign. Do you do that?
Yes. I do the traditional braces in the Invisalign. So most people does not want to show the metal part of braces. So this is an alternative. What we do is we do the planning, send it to Invisalign, and send the scan. The patient will wear the plastic aligners. After maybe 8 months to a year, you can have a straight teeth. Depending on the case, depending on the severity of the case, that's how long the treatment would be. But sometimes I would see a result after 6 months, it's already straight. After I just planned actually my nephew, he had really severe um, uh, crowding, and the plan is he's going to be done in about 8 months. So that's how fast it can be. So it does. I have my scanner, the iTero, will simulate your before and after. So even when you come into my office, if you're interested with Invisalign, I will just scan your teeth and simulate it in 5 minutes. You'll know your result. So
Oh,
that's you'll know already what to expect, and it could even be better with the real aligners when you're used to doing it.
So before we put your 2 minute PSA on, can we answer one of audience question? Oral hygiene and dental health is so important for overall wellness. What kind of education or classes do you do to help patients understand the importance of proper dental care?
Oral hygiene is definitely an important. Flossing is a must. I usually hear a question with, do you floss all your teeth? And and the joke about it is that you need to floss the teeth that you want to keep. So, I mean, proper brushing at least 2 to 3 times a day. Minimum is twice a day of brushing, and then after that's flossing. Um, some people does not do that. What happens when you don't floss is gingivitis will will happen. I just had a patient today and asking me, how do you get gingivitis? So I guess I can answer it here now. So you
Mhm.
know, and what I told him is that you know how we're always eating, and after eating, there's always food that will stuck on our teeth. And if, even though we're brushing, and there's always the sticky film that will get stuck there, and a few hours, there's a lot of bacteria in our mouth, and that will cause inflammation. And the bleeding will start. So if you don't floss, and then you started flossing, you're still bleeding. Don't let the bleeding scare you. It's telling you that you need to floss more because
Right.
there's bacteria there, and that's gonna help. If you do it more often, that bleeding will resolve. But
Oh.
visit your dentist every 6 months. If your dentist say that you need a deep cleaning, it's because that bacteria went into deeper into the gums and causes bone loss.
Wait, I have a question. Oh, sorry.
Right.
Oh, were you done, Doc? um, what about water picks or like, do those help or yeah?
Okay, water picks would remove the loose debris. So you still need after
Flash.
after brushing, even if you have the water pick, it will remove the loose debris and you still need to floss because those food in between that stick there, it's not gonna come out with just a water pick.
Okay.
Yes.
And what's your take on electronic, sorry, electronic toothbrushes, like the sonic brush, all of that? Are they
For me,
better?
well,
Are they
it's
better?
for somebody that's having a hard time, dexterity of their hand, and having a hard time, getting there, and the electric toothbrush will definitely help. But be gentle when you're using the electric toothbrush.
Mhm.
It could also damage your gums, your recession. It could have a gum recession, and also um, you have to do it individual teeth.
Oh.
You have to do it individual teeth and spend time. For me, I, I like the traditional manual toothbrush,
Mm.
but you always use a soft bristle and longer brushing will do it.
Okay.
Okay, and then flossing after that. So most of the time we accumulate plaque and build up around the bottom of their teeth.
Mhm.
So just brush more on that area. So that usually what I see with my patients is this where they accumulate a plaque buildup, and
Mhm.
it becomes like a cement that you have a hard time taking it out. So spending time using soft bristles will do it. If anybody likes the electric, definitely use that, but it's gentle when you use it. I highly recommend not to scrub your
That's what I do. Yeah.
go like this, more on circular, up and down, inside and out, because sometimes it could just, especially with medium and hard bristle, it could cause damage to the teeth.
Yeah.
Yeah. But also, another thing that I wanted to add, uh, if you if you have any sensitivity, sometimes when you grind your teeth, that could cause also recession on the like the margin of your tooth. That tends to be sensitive. So you need to check your doctor, your dentist, to have it checked, and maybe you need to wear a mouthpiece when sleeping, so you can avoid that grinding. So, how
Yes.
am I doing so far?
Very
Great.
well.
I have a list of
It
questions, of
doesn't
personal
sound like he's
questions.
nervous, right?
No, not at all.
So I just want to add this because I'm just grateful for the chamber because it's my third year. It has enhanced my leadership muscle because our president here is puts up to make us make us really work and really be on top of things, and I'm
Mhm.
grateful. Thank you. So and all the rest of the
You're not
chamber.
supposed to put me on the spot. We're supposed to put you on the spot.
The chamber because you definitely have helped me. And my speaking, I usually before I get so scared and terrified in front of this audience, but I'm practicing. So yeah.
With that, I think it's time for our VP of membership to do a membership plug.
Yes.
Sure, why not? So yes, we are again. This is the Philippine American Chamber of Commerce, South Bay, Los Angeles area. There are a lot of different PhilAm chambers across Southern California, but for FACC SLAA, our territory is essentially the 10 freeway south and the 605 freeway west. So obviously all the beach cities and into downtown Los Angeles. But as a Chamber of Commerce, what we do is we give our membership an opportunity to be able to meet and to network with other business owners, entrepreneurs, and professionals. Granted, in this climate that we're in right now, we're unable to do the regular meetings and face-to-face mixtures that we're used to doing. But the way we've worked around that is to have online events like this. We actually have a Zoom networking mixer this Sunday. But yes, we definitely would love to have you join us as a member of the Philippine American Chamber of Commerce of South Bay, Los Angeles area. And a great way to kind of test the waters, so to speak, would be to attend our networking mixer this Sunday, which is July 12th, from 5 to 6 in the afternoon. Traffic is not going to be an issue because it's online. So definitely, check us out. And if you see that this is something that could be of value to yourself, to your business, to your company or your association, let us know. We'd love to have you join us. Philippine American Chamber of Commerce, South Bay, Los Angeles area.
And how do they contact you for membership, Fred?
Oh, you can reach us very easily. We're all throughout social media, but by email, it's facc.slaa@gmail.com. We're on Facebook, we're on Instagram, we're on Twitter, on YouTube. There's all these different ways to get a hold of us. And certainly you can contact any of the board members. But myself, Fred Docdosso, I am the VP of membership this year, and I'd love to answer any questions you might have about our chamber.
Yes, and for everybody's knowledge, Fred Docdosso is a president emeritus. I succeeded him after his term, and he's been with this chamber from its inception. So he knows every single thing about this chamber, much more than I do. And he's also our historian, right? Our official historian. Because ask him anything about the chamber, I'm pretty sure he knows the answer. But
it's exciting to be able to help the community while at the same time helping yourself as a person, as a professional, as a business owner and an entrepreneur. So it's a win-win all the way around.
Yeah, I think this is a good time for our commercial break. PSA from Dr. Maricel Aluning and our Clean Power Alliance, who's our sponsor. Go ahead, Kat.
Welcome to Carson Dental Care.
Hi, I'm Dr. Maricel Aluning, a general dentist, practicing in the city of Carson since 1998. The practice has been here since the 70s, and when my uncle retired in the year 2000, I just took over his practice. I have 6 team members, and we have over 1,000 active clients. Here in our office, we also offer services such as cosmetic dentistry, like Invisalign, crown and bridges, teeth whitening, traditional braces, implants, and now sleep study.
Before you arrive at our office, we ensure that we gather all the information needed to minimize your wait time. Our wait room feels like home. We offer complimentary coffee, tea, water, and some snacks. Here at Carson Dental Care, we make sure that our clients are comfortable.
My family and I have been coming to Carson Dental Care for 2 years. We love and trust Carson Dental Care because they have never hurt us throughout any of the operations or cleanings that they've performed on us. They have always been very professional, and their payment system is very doable, especially for families like us.
For clients without insurance, we offer a dental assistance savings plan, as well as different financing options. If you have any questions about your insurance, we will be happy to help you.
Everybody, you need to come to her. Come straight to her. I'm terrified of needles and I felt nothing. It's amazing. I didn't even feel it, not 1 inch. It's amazing. I love you.
Carson Dental Care is open from Monday to Friday from 9 a.m. to 6 p.m. and Saturdays from 9 to 2 p.m. We're always accepting new clients, so come check us out.
During this challenging time, there are ways you can save money or find assistance when it comes to your energy bill through Clean Power Alliance. CPA has created a $1 million COVID-19 relief program that provides bill credits to customers impacted by the pandemic. In addition, Clean Power Alliance offers 3 different financial assistance programs for eligible customers. With the CARE program, also known as the California Alternate Rates for Energy, you can reduce your bill by about 30%. Your energy bill can be reduced by about 18% through the FARA program, also known as the Family Electric Rate Assistance Program. And the Medical Baseline program supplies additional energy at no extra cost to your normal energy use for homes that need or use medical equipment. To find out if you are eligible for any of the financial assistance programs, you can head to cleanpoweralliance.org.
Great. So that commercial was done last year. So, this time because of COVID pandemic, we no longer have to we couldn't put our snacks in the lobby anymore. Take that out. So we just give them water now. But if they request coffee, we can still give it to them, and we still have some snacks. But we can like openly put them in the lobby.
Doc, before we aired your PSA, I actually have more questions. I have very sensitive teeth, and I noticed that my gum is receding. Is there a way for me to? I'm trying not to, but I always brush the wrong way, like you were talking about. Don't go back and forth. Is there a way for me to stop it from receding so fast, or is there something that I can do? Or you can do.
Before I answer that, let me ask you this: Do you think that you grind your teeth at night?
Yes, I've been told, and I've been given a sleep guard. I think it was 3 years ago, and I don't use it.
Okay, so you have to use that because it can help you from getting more of those recessions. So and also by grinding, if you grind your teeth, it could damage more of it wears out the incisal edges of the teeth or the top of the teeth. So those guards is meant to be used at night. I know it could be it can be a nuisance, it can be annoying, but
Yeah.
that will help you especially your joints to heal. If you're having some, sometimes migraine comes from having a malocclusion. If you're having headaches, it could have something to do with your body.
Oh,
Um, I have helped some of my patients with T&J problems and after races. It has made it feel better. But if they don't use the mouthpiece after that, then it goes back.
so are you
And
saying?
for the sensitivity though, it's breaking. What we can do for the sensitivity is the immediate cure for that is we can do bonding. We can cover it with a filling, a 2-core filling, so that the air, the squeeze does not go in there, and it will relieve your sensitivity. And if you use fluoride varnish,
Yes.
that will help that as well, or desensitizer when you come to your dentist. So those are the things that can help, and plus, but the grinding definitely is a contributing factor of this abrasion. We call it abrasions. Of that having that kind of like a V-shaped concavity on your teeth, and it could be sensitive, very sensitive.
It is. Is that covered by insurance?
Yeah. Well, depending.
Okay, I'll come see
After
you.
other people insure us.
It can be covered if there's really deep enough that you're having pain and it's really causing discomfort. Uh, Sometimes insurance will say it's not a covered benefit, so we can definitely check that out for you. But in my office, it can be covered.
Yeah, I like that.
Well, speaking of that, Dawn has another question for us. You want to read it for us?
Yeah, sure. Her question is: do you offer or know any other service providers that help with patients that have lost their teeth due to drug abuse? There are many people that have changed their life around and are clean and off drugs now, but are self conscious with low self esteem due to their bad teeth and find it difficult to incorporate back into society.
Yes, I have several of those patients, and I have helped them. Actually, the patients that was almost in tears this morning was probably one, and she lost all her teeth, and it's really first medical will help, pay for well, it has they have to be examined first if really severely badly decayed and the only option would be remove the teeth, then medical definitely will pay for that, will help pay for that, and also dentures. And my goal really right now is to maybe give away uh, free dentistry once a month or every quarter to help those people that are really in need. So that's my goal. I mean, hopefully, well, we can probably make it happen as a chamber. Way a smile makeover last year, and even now he's still in the process. I'm still in the process of perfecting his smile. He was in earlier this afternoon actually. So yeah, for those people, definitely we can help them. Again, an exam would be needed, a comprehensive exam, and then we can go from there. So if they have medical, most of them would have medical. So, and I accept them, those insurance, so they can come to my practice and I'll evaluate and we can go from there and hopefully give their smile back because that's one of my thing to always make people smile and giving back. So yeah.
That's awesome that you're giving back in the way that you're best at. So thank you so much for that.
We can definitely put that in the works as a chamber of uh, giving back to the community, of giving someone a smile back, like what I did last year. So we can put that in the works. And
So
also
I
to
think
add,
that's an idea for us to raffle off that as one of
yes,
our prizes for our members, right?
okay, perfect, yeah, definitely. Because from my 19-year of anniversary, I did give away worth $10,000 worth of smile makeover, and I'm going on my 20th. It's always my way of giving back. It's always good to give back to the community.
That's great. That's great. Well, you're already doing a great job with your dentistry and a great job with giving back through the Philippine American Chamber of Commerce. And we thank you for all that you do. And, people don't know how much work also is behind everything that we do on the front end. They just see our live feed, they just see, our workshops, our webinars. They don't know the amount of work that happens outside of that and the amount of hours that we volunteer, to the betterment of our members. And I really appreciate all of our board members who have been really relentless in putting in the effort. And so, there's no better chamber to be in than this, right? So,
Exactly.
yeah, that's
That
my
is
shameless
the
plug.
word.
That's my shameless plug.
Yes.
And please, this way, talk to Fred about membership. Fred, any more questions? I know you have family. How about, questions for the family members or
Well, yeah, actually, your commercial, doc, it mentioned that you offer a sleep study, which you kind of touched on earlier. How exactly does that work, and why do people need that sleep study?
Okay, technically, it should be the medical physician that would diagnose that you have sleep apnea. So for somebody that always get tired, we have a questionnaire. For somebody that is always tired in the on the daytime, that always feels sleepy, they snore heavily, and if your partner is telling you you stop breathing at night, sounds like that could be that person have sleep apnea. So what it is when you're sleeping, the tongue is blocking the airway, so you're not getting enough oxygen, and when you don't get enough oxygen, you you wake up tired and sluggish and hypertensive, diabetic, and it's all linked. So having good night's sleep is a must. Where we come in, and then if you have something that you're feeling that the doctor cannot find out what's going on, it could be that. So you need to be the doctor has to prescribe a sleep study. Usually, if your medical physician will order the sleep study, you would have to go to an office where and they put you to sleep there with all the electrodes and all those things. And then the result will come back to the doctor. They will either prescribe a CPAP machine that would that the patient will wear every night when sleeping, and that would blow air so that you can have enough oxygen. Now, where I come in as a dentist, for somebody that is intolerant to wearing a CPAP machine, we can make an appliance wherein the tongue would be move forward with the appliance so that the patient can sleep better. There's enough air coming in. So, and then that the sleep equipment that I have, I will send that to the patient after filling up all the questionnaires, and they can either have 1 day or 2 days of sleep study, and after that they send it back to me, and then I would have to upload it on the cloud so that the sleep doctor can diagnose. I do not diagnose. It still would be the medical physician that would diagnose it. And once I get the result, I have to collaborate with a medical physician to either uh, give the patient a CPAP machine first, and if the patient cannot use that, then I come in as making them an appliance. For somebody that does not have insurance and they just want to go straight uh, wearing that appliance, and we can just order the there's several appliances that they can wear, and also Medicare sometimes will cover that. So and the regular insurance.
I actually got a couple of texts and they're asking, they have kids. Do you take kids as patients?
Yes,
And is there like what age or what's the youngest age you can take? Like she's 4.
I I just had a patient yesterday. She's 2 years old, and she was the best patient. So
The
yeah,
best.
but as
They're
long as the patient is able to, that I'm able to, well, I'm a very patient doctor. I can spend time, and I can listen. I'm a good listener, and I would, so I have those patients. I have the patience to hold them, so that I can take care of them. But if it's somebody that will need a specialist, then definitely I would have to send the specialist because I cannot take everyone. I cannot help everyone. So there's
yeah.
always 20%
But you
that
have the patience for your patients.
I have patience for my patients. Yes.
I
There you
like
go.
Yeah,
Yes.
and I can attest to that. Jordan, my 7-year-old, now 8-year-old, was her one of her patients. So
Yeah.
he likes her now. So that's a good testimonial right there. But I
Yeah.
think when you mentioned sleep apnea, that's one of the criteria of, and I'm segue here for our sponsor, which is the Clean Power Alliance, because they do have a program for people who are using some type of a medical equipment. And so maybe Kat can share one of our PSAs regarding our Clean Power Alliance. And if you guys have any questions, you can reach out to us so we can point you to the right direction, because you can save on your power utility bill if you are using any one of these medical equipments at home, or maybe in fact in the office too, in the business too. So go ahead, Kat. Can we play our
Sa gitna ng nakakabagabag na panahon na ito, ay maraming paraan upang makapagtipid at makakuha ng kinakailangang tulong ukol sa inyong bayarin sa tulong ng CPA o Clean Power Alliance. Ang CPA ay lumikha ng $1 milyong COVID-19 relief program na nagdudulot ng pondong magagamit sa susunod na koleksyon ng nagseserbisyo ng enerhiya para sa mga naapektuhan ng pandemic. Bilang karagdagan, ang Clean Power Alliance ay naghahandog ng 3 uri ng pinansyal na tulong para sa nauukol na tagatangkilik sa pamamagitan ng programang CARE at kilala din sa California Alternate Rates for Energy, ay maaari ninyong pababain ang inyong bayarin sa enerhiya ng halos 30%. Ang inyong bayarin ay maaari ding mabawasan ng halos 18% sa tulong ng FERA, na kilala din sa pangalang Family Electric Rate Assistance Program. At ang programang Medical Baseline naman ay nagdudulot ng karagdagang enerhiya na hindi makakaapekto sa inyong karaniwang bayarin na kinakailangan para sa mga gamitang pang-medisina. Upang malaman kung kayo ay karapat-dapat sa tulong na ito, bisitahin ang cleanpoweralliance.org.
Thank you so much. Those are words from our sponsor. And we have come to the end of our show. You see, it wasn't even painful.
Wow, already?
It's already been an hour time through. Congratulations, we did it. so
Congrats, Doc.
yes, and this is the invitation for our members who wants to be featured in our live cast. So let us know, and we'll share with you how you can be part of our live cast and share this to your friends and family. We are also on YouTube channel, so people can keep rewatching if we've missed one of our live casts or one of our webinars and seminars. All of our broadcasts are available to watch any time of your convenience at our YouTube channel, which is what again, Fred? Fred, can't hear you.
You can look it up under Filipino American Chamber of Commerce of South Bay, Los Angeles area. So FICC SLAA.
And in the future, Kat, do we share with them that we are going to be on where?
On channel 18 in August. Yes. We have more news regarding that, and we'll share it with you as we get closer to the launch date.
Yes, but we are very excited for that new project that the Philippine American Chamber of Commerce is planning for you. So stay tuned for our next broadcast. Please be with us on Sunday, right, Fred? At what time and where?
5 o'clock. That's Sunday, July 12th from 5 to 6 p.m.
So we will be watching out for you, and please join us, because this is one way of networking and keeping ourselves thriving through this, very challenging times, and still keep our business going. So again, we want to say bye, Dr. Maricel. Last words.
Thank you for this opportunity. For anybody that I hope I answered all your questions. If you have more questions, please, you can call us at 310-549-5580. One thing that we did not touch on ours is about insurance. We do take PPO insurance, and also now we can accept Medicare. And they don't cover everything, but maybe part of your surgery, home grafting may be covered. And also medical insurance, the regular traditional medical insurance, we can help. It may be able to help you pay for your dental services. So give us a call. Our website is Carson Dental Cares with an S .com, because we do care about our patients. It's all about you. It's all about our patients. Give us a try. because when you do, you're not gonna want to leave us.
Thank
Thank you for this opportunity. Thank you, Chamber FACC SLAA. I'm enjoying being part of the chamber, and I thank God every day for friends and family and my team, and I'm just grateful. Thank you.
Thank you. Fred and Kat?
Yes, thank you. Thank you so much, Doc. And again, this is an open invite. Anybody that's watching us here today, as Janice mentioned, we have an opportunity to feature our members despite not having the physical meetings and mixers that we've done in the past. We've transitioned to a virtual platform, and as Kat mentioned, we do have some big news coming, but we are going to be going on TV. So that's going to be on LA 18. So this is just another way that we honor and we recognize our business, business owners, entrepreneurs, and professionals in our community. Thank you, everybody.
And Doc, Doc, I'd like to thank you because I'm going to be seeing you soon. I have a bunch of questions about my teeth. And
Okay.
as Fred was mentioning for our YouTube channel, be sure to go on our channel because we do have our past segments. If you have any questions with PPP or any legal questions, they might be answered in our YouTube videos. And also the Katayahan, which we aired, I think, a couple of weeks ago. You can rewatch it there or catch it if you missed it. So be sure to check out our YouTube channel.
And I'd like to ask for you, if you like it, please hit like and subscribe. Thank
Yes.
you.
Yeah.
Have a good day, everyone, and see you on Sunday.
Good night,
Thanks,
everybody.
everybody.
Thank you.
Bye.
Bye. Are we all?